help you while you're pregnant. Tips and tricks. And we asked at the end of the segment if you could leave down on your comments what you would like to hear us talk about next. And you guys said, wow. You guys said type 2 diabetes. Alright, so this segment we will be talking about different categories and different things we can do and touch on them about type 2 diabetes. And some of the things we will touch on are
the role that insulin plays in your blood, in your body, the role that glucose and insulin play together and how they deal with your diabetes and versus a regular working system. The people that you can go see to ask questions about your type 2 diabetes and the diet that you can keep to maintain your low blood sugars and things like that.
We will also talk about the background of type 2 diabetes and what you can get, what are some of the symptoms, what causes it, and we will also talk about the type of exercise and, just like she said, diet of what you can do, especially if you're
especially if you're newly diagnosed.
Yes, what she said.
Yes. So, we'll start with the symptoms.
So some of the symptoms that you can probably see, one thing they say, is that the average person that you usually get to diabetes are usually 45 and older. But through the years, the average has been going down, and the average age to get type 2 diabetes has become lower.
Some symptoms that you might want to ask your doctor about are fatigue, weight loss or weight gain, having sores that heal slower than they normally do, and having dark patches on your skin, like dark spots that are not usually there. Anything out of the ordinary that is something new occurrence, you should ask your doctor about.
Always go to your doctor.
Yes.
They know best. Another thing is the majority to get type 2 diabetes are usually the minorities, Hispanics, African Americans, Asians, Native Americans, all those.
And be sure to keep in mind that if you have a history of having type 2 diabetes in your family, it is hereditary and you can receive it as well. You have a higher chance of receiving it, so that's exactly why you should be working harder to try and not to get type 2 diabetes.
Yes.
In this picture, the blue X's represent insulin and the magenta O's represent glucose. In the regular functions, which is a person who does not have type 2 diabetes, the pancreas produces insulin, which are the blue X's. We eat food that hold sugar, which goes through our esophagus and into our blood vessels. The food you eat has sugars that enter your bloodstream and enter the cells. So as we look at the blood vessel, we see that the glucose and the insulin are interacting peacefully. We'll use peacefully. And the cell door is locked. The only thing that can unlock the cell door to bring nutrients into the cell is the insulin. And so the insulin and glucose work together to bring nutrients to the cell. And that's how your body keeps working. The body produces just the right amount of insulin for the cells to balance out the glucose. Okay, so in the second picture, the second diagram, where the so-called cell door is unlocked, the glucose has entered the cell with the help of the insulin.
Okay, so now we will describe someone who has type 2 diabetes. X that are blue are insulin, and magenta O's are glucose. The pancreas produces insulin still, except the pancreas only produces a small amount of insulin, or X's in this case. You still eat food that has sugars. When the sugar enters the body, it goes into the bloodstream and then enter the cell. Once it enters the blood vessel, the insulin is produced in the blood vessel and the sugars are in the blood vessel. So the cell door is locked and can only be opened with the right amount of insulin. If there is not enough insulin in there, the doors will be locked and the glucose will not be able to enter. Now, as you see in the second diagram, There's a lot more glucose than there is insulin. Except you see one little thing. There's a insulin injection on the cell, and the door is unlocked. Now, cell can only be opened with the use of insulin injection, adding insulin to the bloodstream and then cells. If there is not enough insulin to be produced, then the cell's lock cannot be opened, and the cell without the glucose may die off. So, if someone has type 2 diabetes, they will get usually insulin injections so that their cells won't die off. You have type 2 diabetes.
You might be wondering, who would I go to specifically to speak about my type 2 diabetes? And the first person that you should absolutely go to is your primary care physician, which is your just general family doctor, and just talk to them about some of the medicines that you can take, some of the insulin injections that you need, and just some of the ways that you can, keep your body in shape, because they do recommend, different other physicians that can help you out with those questions.
As well as primary doctors have your history from the beginning.
Yeah, so they have your medical records.
Yes. So they may know you the best they can. So I will believe that's the first person you should ever go see.
Mm-hmm.
Your primary care physician may recommend you to see this next physician, or you may find it yourself, and that should be a nutritionist or dietitian.
Yes.
You should go see them to see how to keep your balanced diet and your exercise so that you can keep your body healthy with type 2 diabetes. I mean, that's as simple as it can get.
And if you ever need any help talking or coping with this problem that you can't find in your family itself, you can always go to a psychologist or a psychiatrist. They can help you get through this hard time if you're having a rough time coping with the fact that you have type 2 diabetes, and you need to talk to someone about it.
Yes. Don't be scared to talk. It's good. It's okay to be scared,
but you shouldn't hold it all in, because it is a serious disease that some people die from. So you need to be aware of the fact that this is serious, and you should take it seriously as well. It is your health, and this is your life.
We don't want to scare you as saying that you're gonna die, but
just be aware of how heavily this can
be approached.
And saying that, we want to make sure you understand that you can still live your life like you were before, just you need to shape it differently.
Yes. So just, you can stay who you are, you can stay who you want to be and where you want to go later in life, but always just shape it just a little bit different so that you can bring it all together and you're happy
and maintain your type 2 diabetes.
Yeah.
So the 3 people we recommended were psychologists.
Yes.
The nutritionist or dietitian.
And the primary care physician.
So those are the 3 people that you should go check out. And if you don't have any of these people, we will
gladly
send you links to.
If you do need them, you can comment and we'll find you some way to get them their names. We want to talk about you, the overwhelmed, scared, or curious viewers.
We just like to let you know that you're not the only person going through having type 2 diabetes, and it is a serious thing to go through, but just know it's not the end of the world.
Yes, and it also depends on how you take it. It could be positive, negative, but always remember that it's how you make it.
Yes, and definitely go check out the doctors and specialists that we recommended, because it's important that you can have an open communication line with your doctors and just have a good communication in general to know what's happening in your body and know what's happening with your body, and just be able to take a hold, because this is your disease, this is your life, so just be able to
you gotta live it to the fullest
to manage that.
Nothing should stop it.
Yes. So
closing. every segment, please, at the comments, comment on what you want us to talk about for next week.
And if you have any questions about this segment, make sure you comment down below.
And we will answer them the best of our ability. And yeah, so shout out to Squad.
Squad. Okay. 11F.